Hi, I am Dr. Harish Puranik. I am a consultant in arthroscopic surgeries and sports medicine. I work at Fortis Hospital and my clinic called Spire Clinic. I am going to talk about 10 steps which you need to do for a successful Bankart's repair. About 1.7% of the adult population suffer from recurrent shoulder dislocation. This is a problem which is predominantly seen in the young, active male population. The primary modality of treatment for patients with shoulder dislocation is for arthroscopic stabilization. Unfortunately, the failure rates with arthroscopic stabilization vary from about 19 to 33% from 10 to 2 years from the date of surgery. Now, this is a rather large percentage of failure rates. Therefore, it's very important for us to address this issue to ensure that a successful Bankart's repair is done. Here are 10 steps to ensure that your Bankart's repair doesn't fail. The first step is to do a proper arthroscopic diagnostic round to see what is happening inside the shoulder joint. This involves looking at the glenohumeral ligaments, looking at the biceps tendon, looking at the slap region, looking at the cuff, the posterior labrum, as well as evaluating the heel sac. A proper diagnostic round of arthroscopy is the first step in getting your Bankart's right. The second step is to get your portals correct. The most important area for a Bankart's repair is from the 12 o'clock to the 6 o'clock position. So when you're putting your portals, two important things that we need to look at. One is visibility, the second is accessibility. So ensure that the portals that you're putting give you good visibility and good accessibility. This perhaps is the most important step with regards to stabilization of your labrum as well as the heel sac repair. So steps 2, get your portals right, make sure that your portals give good visibility and accessibility. Step 3, the most important step, and this is to recreate the biology both at the side of the labrum as well as at the heel sac. Now, the native anatomy is distorted, and because of recurrent dislocations, the biology gets wavered. So it's very important to recreate this biology. This involves freshening up of the edges of the labrum side, freshening up the bony edges on the side of the glenoid, making sure that the heel sac, the defect on the heel sac is also freshened up, making sure that you debride all the other soft tissues which are there across the biceps as well as the labrum. So recreating the biology by debriding the dead tissue and ensuring that there is fresh bleeding edges at all sides is the third most important step on your Bankart's repair. Step 4 is to elevate the labrum and mobilize the labrum. This is again a very important step. This is to ensure that the labrum which is slipped down or which is moved out of its place is elevated back to its original place and is mobilized sufficient enough so that it comes back to its original anatomic location. So this generally takes a little bit of time and patience to recognize and to understand where the original labrum sits. It's very, very important for us to ensure that we are able to elevate the labrum and get it back to its natural original anatomy. Step 5, the first bite is also called as the inferior most bite, and this involves shifting your inferior capsule upwards, also called as the capsular shift. So the fifth step is the most important step in your Bankart's repair, and the first bite that you take does the inferior capsular shift, and this does most of the job in reducing the humeral head back to its original place. So ensure that you get a big chunk of the capsule as well as the labrum and get the capsular shift correct. Step 6 is to ensure that you do an anterior capsular tightening. So an important component of Bankart's repair is not just getting the labrum back, but also ensuring that the anterior capsule becomes tight enough. So step 6 is to get your anterior capsule to be tight enough so that it ensures that the humeral head sits back at its place. Step 7 is to get your anterior capsulolabral part back to the glenoid. This is the third step of your Bankart's repair, and this ensures that the capsule as well as the labrum comes back to its original place onto the labrum. Step 5, step 6, step 7, capsular shift, anterior capsular tightening as well as a capsulolabral repair. Step 8 is to address any concomitant injuries. Look at the biceps if it requires a tenotomy or a tenodosis. Look at the slap region if it requires a repair or stabilization. Address any concomitant cuff pathology. Also visualize the posterior labral area, see if there is a tear, and if it requires any addressing, you need to do a repair at that place. Step 9 is to ensure that you do an adequate remplissage. This is again an invaluable asset to ensure that you can get an off-track lesion back to form an on-track lesion. So ensure that your Bankart's repair is completed only when you get your remplissage done as well, based on your indications. Step 10 is to finally look at the visualization and ensure that the head is placed right at the center of the glenoid and is tracking well. So these are the 10 steps that you would wish to follow to get your Bankart's repair done properly. Thank you.